those kind of things can really have a long, sticky imprint in the nervous system. And it can create a very stressful sympathetic bias, like a hypervigilance, we call it, in the nervous system. And I see this associated with many, many of the chronic disorders that we're talking about. From they makes a subject way more susceptible to other triggers that can create sort of this ball of chronic disease. So adverse childhood events, early life stress, particularly in females that have been in that environment of not feeling safe, feeling under threat, not feeling secure, not feeling loved. It could be any or all of those things, right? End up in a bias of the nervous system that is in very similar metabolically and physiologically to a classic post-traumatic stress disorder, but on some level in an ongoing basis. And it makes them much more susceptible to things like anxiety, depression, insomnia, never going into deep restorative sleep. They're very susceptible to post-viral syndromes. So they tend to be the people who develop chronic fatigue syndrome, ME. They tend to be the people that develop fibromyalgia. They are more likely to be the people who got long haul COVID after exposure to SARS-CoV-2. And they're much more likely to be diagnosed with IBS, irritable bowel syndrome, or some level of what they used to call functional gut disorders, DGBIs, disorders of gut-brain interaction. So it's a complicated mess, and unless the doctor even goes back that far, they'll never know really much about you. You can walk in, seem to really have your stuff together, seem to be in a high, even, social status. Everything is great. You got a great spouse. You got good kids. Everything looks fine. You start asking them about their childhood, it was a train wreck, right? And they're carrying that stuff with them. It's not gone. I mean, because this isn't a conscious thing. It's a subconscious underlying, dysfunction in the central nervous system that can create amplified perceptions of pain, amplified perceptions of worry and anxiety. And I think what it does more than anything is it makes people always on guard to the point that they never go into stage 3 and 4 sleep, and they never
Wow.
truly rest. They never get restored. So often when you talk to them, again, doing a history, how do you sleep? I have a hard time getting to sleep because my mind's always racing. But then
Yep.
once I get to sleep, some of them, they get up every 4 hours and they can't get back to sleep. But some of them, will say, well, I can sleep for 12 hours, but I get up and I feel like I never slept. Because it's not just the time sleeping, it's, going through the cycles of sleep, as we know. And you got to get into that restorative sleep to rejuvenate, to have your body repair itself and your mind to rest enough and repair itself to confront another day, right? And deal with normal stressors. So all of those things are really hard to unwind. And if you don't even ask about them, and you never consider them, and all you're trying to do is attach a symptom to a pharmaceutical and get out of the treatment room in 3 minutes because you got 30 more patients waiting, and you're only going to get paid so much from the insurance company for the ICD-10 code you're going to use. You don't have time to do any of that, right?